can answer questions.
I will start. The issue of the rate package, I was, Mr. Mecca's hair was all black. I was probably about a size 8. Translated, it was many years ago. I think Mr. Mecca and I think Ms. Aroner were here and helped develop the rate package for the group home process. And I don't think it was done through, at least the work groups that I remember spending hours participating in. I don't remember that it was driven through the budget process. It felt like there were legislative work groups that did that work. And I say that to say I worry about the time frame of the rate package, you know, coming about through the budget process. I mean, I'm clear it has to be funded, but just, you know, kind of how it starts, the level of transparency, the people at the table providing input into it, having had that experience myself many years ago. And you're comfortable that you will have a well-informed, fleshed out package that will be ready to be released. It may revise and go through the process that quickly?
I certainly hope so. Now, whether everyone is going to see everything they wanted in whatever emerges, that's a different conversation.
Not so much what they wanted, but, you know, there's, as I recall in terms of my own experience, you know, thinking through, which we were doing at that time, the appropriateness of shift care, thinking through the impact the rate package has on placement, on the kinds of services that would be afforded to the children at the various levels. There's still a lot of work that has to go into figuring out what you'll be paying for and how to make sure that it's adequate and appropriate in the various care communities, if you will. So not that everybody's seen it and everybody gives you a thumbs up, but that it really is appropriate.
I think I can say confidently that the framework as it has been shared, people see the inherent logic to it and that it's addressing the goals and purposes of the continuum of care reform. But because we have not yet shared specific dollar numbers, and that's still in sort of the development process, that's the hesitancy. I just don't want to get out over my skis.
Okay, fair enough.
If I may, I just would add one comment to that. Although we've been talking about the rate package largely in this budget here, in this budget cycle, the work actually began as part of our legislative report a few years ago. So a lot of the kind of that work seeded and provided the foundation for the work that was finished up this year. So it's not that we kind of rushed it through in just a few months. It's a culmination of several years of conversations with a large group of people.
Right. All right, thank you for that clarification. Any comment from Finance or LAO on the oversight?
Good afternoon, Madam Chair. Ben Johnson again with the Legislative Analyst's Office. In our analysis of the Human Services budget, we say that we do believe that the Governor's proposal is a reasonable first step in the implementation of CCR, understanding that there's continued work to be done on the costs of implementing certain components and so forth that's being carried out between the state and its county partners. We do want to raise several issues of remaining uncertainty, the first related to what the rates will be. And much of the long-term savings of the continuum of care reform are associated with, one, the speed at which children exit group homes and into less costly placements, and then two, in what rates we pay to those new families and providers who take those children in. So it is essential to have these rates numbers in place, and as Mr. Lightbourne said, we expect them by May revise, and at that point we should have a much better understanding of what the costs of CCR are going to be, especially in the budget year. We did review the framework that DSS did propose, and upon preliminary review, we do think it does address some of our concerns about how children in non-foster family agencies and STRTPs are going to receive some needed services. The second issue we'd like to raise concerns realignment and Prop 30 obligations of the state to fully fund any new requirements that we do impose. And so we recommend that DSS create a mechanism for tracking county savings and costs related to CCR implementation at each county for the various components that of implementation that CCR has to, that we have to do. And then our final issue of uncertainty surrounds mental health and how it's going to be integrated with child welfare services. As Mr. Lightbourne said, there is continued uncertainty about who is going to certify both the FFAs and the STRTPs, what services are going to be provided and where those services are going to be provided. So we understand that there are work groups that are being undergone between DHCS stakeholders and DSS, but a lot of work continues to need to be done. Thank you.
Agreed. Any questions, Senator Monty? Okay. I think I'll hold public comment until after we hear from our next panel of stakeholders here. Right, so we're just going to ask that Mr. Mecca join the table and provide comment from the perspective of the counties on CCR planning and implementation.
Thank you, Madam Chair. Frank Mecca on behalf of the County Human Services Directors. We've been intimately involved in CCR since its inception. In fact, my staff, I think, co-chaired the original committee that started conceiving CCR when the C stood for congregate and not continuum. It's evolved since then. And since that point to where we are today, we've been fully committed to the successful implementation of CCR. And that's to the philosophy that underlies it, to the premises that drove that philosophy, and to the implementation steps that were outlined in AB 403. I think Ms. Cho said earlier that this is an exciting time for child welfare, and I think we agree with that. This is absolutely the right way to go. Mr. Lightbourne outlined a huge amount of work that's been done already in full partnership with the counties, and I won't detail it other than to say it's absolutely the case. And we feel like, and we are, completely vested partners in all the implementation steps. There's an extraordinary amount of work that's been done. In some ways, CCR sounds like a pretty simple philosophy. In many ways, the culture change, the supports that are necessary to implement are many. The amount of work that the department's been doing in partnership with the Department of Healthcare Services, us and other stakeholders, I don't think we could do more, and I don't know that we could do it any faster. And we've been very pleased with the process to date. From the standpoint of our directors, we think that the success or failure of CCR is going to turn on three major factors. The first is going to be our ability to recruit and support and keep relatives and foster families as an alternative or as a place to step a child down after a treatment in an STRTC. The second is going to be an adequate and effective and timely array of mental health supports for children in the foster care system. And the third is going to be an adequate and trained child welfare staff that can case manage in this new way envisioned by CCR, which is a child and family team, which, as Mr. Lightbourne pointed out, is not a new concept. And it certainly, teaming happens now, but it is audacious and appropriate, but nonetheless daunting to implement a system where every child in the system is case managed and served by a team, not just a lone social worker who then goes out and brokers and barters and begs for services from other systems where everyone's at the table. I'm going to discuss the child and family teaming and the foster family supports. I know there are other items, I think on Part B, to discuss mental health services. So with respect to those two pieces, since the January budget came out, and I think we've been clear that the January budget as a starting place, we appreciated its characterization as a starting place because it was not of itself sufficiently, it didn't sufficiently resource the key activities. We've been in very close conversations with the administration about the resources necessary to adequately fund at least minimally functional, effective child and family teams for every case. And we've been in discussions with what is the right amount of resources to recruit the families that we would need in lieu of alternative, less ideal placements for youth. And there's been a lot of progress in the course of those discussions, and we've been pleased about that. I think it's important to point out that we aren't there yet. There is, if I could quote Mr. Lightbourne's comment to the Assembly Budget Committee, there still is daylight, and there still is a significant amount of concern on the part of my members that the resources will be there. And so we're hoping that between now and the May revision, the daylight will close. We'll find consensus. And time really is of the essence, because once we, who aren't actually doing the implementation work, agree, the legislature passes a budget, the counties then have to take those resources, hire the workers, train the workers. There's a whole new assessment process, a tool that's in the course of being selected that workers will have to be trained on. We'll have to further intensify our recruitment and support efforts. Some of those have started for sure, but intensify those with the resources that the legislature makes available. And that's, a July legislative decision, August allocation decisions, and a January 1st implementation date. And while I think I agree that we're not going to see on January 1st the entire world different, but there are a number of expectations and mandates articulated in AB 403 that absolutely all have to happen January 1st. And we want to be committed to making that happen and fulfill the expectations and the mandates of AB 403. So we appreciate the attention of the committee and the partnership of the administration and all the stakeholders who've all been pointing in the right direction. And we hope that in May we have a state, county, and partner consensus on the supports necessary to be able to move forward and succeed.
Finance, any comment? All right, let's open up to public comment on the CCR oversight.
Good afternoon, Madam Chair, Service Employees International Union, Tia Orr. We would like to echo a lot of the comments that Mr. Mecca stressed on the dais. We obviously represent tens of thousands of social workers across the state of California. And like Mr. Mecca, I think all of our social workers and all of the workers involved in child welfare agree that this is a smart, very responsible policy. But to be frank with you, Madam Chair, the social workers can't do it. We can't do it if we don't get the funding. We can't do this remarkable policy if we don't staff the workers. Last year, we came out in support of AB 403. We thought it was a smart policy, but to be honest, we were nervous about it because there wasn't any funding attached to it. We had a commitment that we would address the funding this year, and unfortunately, the January proposal is woefully short of what our needs are. We have not been at the table thus far to discuss what the needs are. I know we have a meeting coming up with the department, but our social workers are very crucial to making this work. And in order for us to prevent cracks from widening, and unfortunately those who fall through the cracks and suffer the consequences are kids, we have to voice our concerns about this. And as difficult as it is to kind of question this policy, we have to come forth and let you know that under the current budget proposal, with the current demands of this policy, our workers can't do it. So we need to address this. Thank you.
Thank you. Next witness, please.
Thank you. Good afternoon, Madam Chair and Senator Monning. I'm Farah McDade-Ting with the California State Association of Counties, representing all 58 counties in California. First, I want to thank not only this committee, but also the staff members of DSS who have worked very, very hard. As you've heard many times over today, implementation is hurtling toward us, and DSS and DHCS have made incredible efforts. I've never seen a department work so quickly and so hard on something. So I want to say thank you. As you've also heard, we have concerns about resources and what might be available in the 16-17 budget. Mr. Mecca, I want to align my comments with Mr. Mecca. Overall, there is concern among counties, but we are working hard. As Mr. Liborn indicated, many counties are trying to do implementation procedures now. It will take some time to hire the folks and get people used to working together and trained on how to work in the child and family teams for many counties. We do have the social worker aspect as well as the mental health worker aspect and probation. So we're working very hard to stay on the same page. We're all in this fast-moving car together. We agree with the policy and supported AB 403, and we hope that the budget proposal or the May revision will have more resources for counties to actually implement. Thank you.
Thank you. Next witness, please.
Madam Chair, Senator Monning, Juliana Voris here on behalf of the urban counties of California. Just wanted to note that our board, one of our top budget priorities is to ensure adequate funding for the implementation of AB 403 and CCR. I think I would align my comments with Mr. Mecca and CSAC regarding all the work that's gone in today. I know there's been a lot of meetings and stakeholder involvement, but it does cross over a few county issue areas, mental health, probation, child welfare, and so we just need to ensure that there's adequate resources to make this successful come January. Thank you.
Thank you. Next witness.
Hi, Jackie Ruthheiser with the California Alliance of Child and Family Services, and once again, we represent private agencies, 50% of all adoption agencies, foster family agencies, group homes, soon to be STRTPs. We're nationally accredited, and we have worked with everybody in this room probably, but definitely everyone at this table for 4 years. We have loved the collaboration and the openness and new ideas and breakthroughs, and even though much of what is said seems obvious, a child and family team for every youth, that probably took, well, it's embarrassing to say how long it took to get there, but it took a long time to get there. Without the resources, though, all these great ideas won't work. The main part was serve the child where they are placed, where they're living. Don't keep moving the child. So foster family agencies are now going to be able to be serving relatives with the child in that home. And for us, even though we've been there every step of the way, we haven't been there in this last final stage, seeing what the resources are. And so we are looking forward to that, and we hope that they are adequate in order to really accomplish what we all really want to do. Thank you.
Thank you. Next witness, please.
Good afternoon. This is Kirsten Barlow with the County Behavioral Health Directors Association. I just wanted to play a little bit off of what has already been raised by our county counterparts to talk specifically about the mental health implications, really, of CCR. I know there's an opportunity to talk a little bit about a narrow piece of what's in the January budget during Part B of the agenda, but that's actually sort of symbolic from our standpoint that in the January budget, only a very small aspect of new activity was contemplated at the time of that being developed, in that specifically, it seemed to have been envisioned in the January budget that the county mental health department's responsibility and new roles would really only be limited to this small 400 or so number of kids, whereas I think as we've become more and more intensely involved in the dialogue, the vision really is that county mental health, and that mental health in particular, is one of the pieces that really, as Mr. Mecca pointed, is a point in which the success of CCR really turns. And so we're trying to better understand and seek clarity around the scope and a level of involvement that's anticipated for kids who do need, obviously, mental health supports, and how are those any different from the things that the county mental health departments are already in contract with the Department of Healthcare Services to provide. We completely agree that there's a wide array of mental health supports for kids all over California that probably could be augmented, but clearly we do have our own issues as it is with timely access and workforce shortages. So are trying to really analyze what's realistic and what the difference is between what we currently provide to kids and what's contemplated by the community of a continuum of care reform issue. And then I would just say that we're definitely also interested in the conversation that we're having with both departments about the design of CCR and, you know, really keeping kids' needs at the center point, that moving kids around in order to get them services, we completely agree that that's contrary to what both of our systems really focus on in terms of least restrictive setting and bringing services to where the consumer is. And in this case, if that child's in a placement or with kin, bringing intensive services to them rather than moving them into a group home or a therapeutic foster care placement is really most ideal. And we look forward to continuing to partner. And we have lots of meetings that we're going to. And thank you for all of the support from Department of Social Services and Healthcare Services in bringing us into the fray. Thanks.
Thank you. Next witness, please.
Gail Johnson, Vaughn Families Now. I wanted to add to the 3 pillars that Mr. Mecca stated in success of CCR, a 4th pillar, which is not just moving children into lower level, less costly levels of care, but into permanent families. And the child-centered specialized permanency services we spoke of are really key to this success. So it's very important, while CCR does include all of the elements in their core services, that we have adequate funding that allows that. These services pay for themselves so profoundly that they will, in fact, make sure that we are budget neutral, but we have to have the money in there up front. Thank you.
Thank you. Next witness.
Brenda Dabney with the Children's Law Center, California. Again, in theory, we all support the CCR efforts. We've been at the table in the very beginning, and we're very hopeful that all of the reform efforts will do what the department has claimed today that they will. We just want to make sure that that the chairperson understands that the appropriate supports for relative caregivers are imperative if this is to go forward, both in terms of funding and in terms of actual services. Relative caregivers are very important to children's lives, and the ability to adequately fund them will be important. And then secondly, that any supports are in place prior to children transitioning down from group home care. That's another very important thing. I'm sure Madam Chair remembers in LA County when McLaren Children's Center closed and youth were not given appropriate mental health services. Many of them ended up in our juvenile justice system, and we do not want to see that happen throughout the state. Thank you.
Thank you. Final witness.
Angie Schwartz with the Alliance for Children's Rights. And as our previous speaker just spoke, families and especially our relatives are really critical to the success of CCR. And while we're very encouraged by the conversations to date that the framework for the new rate system is going to be supportive of these families, and in fact will be creating a new unified tiered system that will apply to all of our families, including our relatives. As we've discussed here today, we have yet to actually see the details of that rate proposal, and so it's hard for us to assess whether or not the rates are actually going to deliver on the promise, especially for our relatives, that they truly are going to get the support that they need and that they are going to be treated as equal partners in the system, and that the level of funding of the rates themselves is going to be enough to really empower our families to do the very hard work that we're asking them to do. So we very much hope that we're going to get adequate time to review the details of the proposal and provide feedback, before that whole new system is finalized. Thank you.
Thank you very much. Any comments or responses before we move on to your budget change proposal? Okay, let's move on to issue 2, funding continuum of care reform implementation. We're on page 27 of the agenda.
So Greg Rose again for the Department of Social Services. You've heard many folks talk about the work that has been done and the work that still needs to be done. What the department has done thus far has, we've done something that's fairly novel in state service, and we've taken 30 some odd folks from 4 or 5 different of the silos within the department and put them together in a team under single leadership to get the work done. We jump-started this work with this crew of folks, and we've come as far as we've come because of that. But this level of effort needs to be sustained over some time. So this proposal asks for some limited term dollars to support this team for some years.
Great. Any comments from LAO?
Yes, Ben Johnson from the LAO. We did review this budget change proposal, and we do believe that it is justified given the significant workload that needs to be accomplished both before January 1st and into the out years. So we have no concerns.
Thank you. Finance? Any public comment on the budget change proposal with regard to the positions? Senator Mondi? I should have said at the top of the hearing that we won't be taking any votes today, that we're going to hold all these items open, and that will include this final budget change proposal. Thank you very much, Director. Appreciate your attendance and participation today. Before we transition to Part B, I'm just going to suggest that we take 5 minutes or less. Director, I see you, and I know you've been here all day. I appreciate that, but it will be less than 5 minutes, so you too can get up and stretch. And so we will take a brief recess, and I'll gavel back down in less than 5 minutes to start Part B of our agenda today.